In this video, I will talk about unconsciousness, its causes and management. Unconsciousness is an abnormal state of lack of response to sensory stimuli to the extent that the person is not aware of self and the surrounding environment. It may be transient or may last for months. There are three levels of unconsciousness: excitatory unconsciousness, somnolent, and stuporous. Excitatory unconsciousness is when the patient does not respond reasonably but may be disturbed by sensory stimuli. A common example is patients under anesthesia. In somnolent, patient is extremely drowsy and respond only to strong verbal or tactile stimuli. In stupor, patients respond only to painful stimuli such as pricking or pinching of the skin. Causes of unconsciousness. These include metabolic, drug poisoning, for example, carbon monoxide poisoning and alcohol intoxication, hypoglycemia, hyperglycemia, and resulting ketoacidosis, hypoxia, carbon dioxide narcosis due to COPD, septicemia, hypothermia, myxedema, Addisonian crisis, hepatic or uremic encephalopathy, neurological trauma, infections like meningitis, encephalitis, malaria, typhoid, rabies, they can all cause unconsciousness. Tumors, especially of brain origin, cerebral and meningeal. Vascular causes include subdural or subarachnoid hemorrhage, stroke, hypertensive encephalopathy. Epilepsy is also a common cause of unconsciousness. Now, how to diagnose unconsciousness? The most important part is history. The onset of coma, whether it is abrupt or gradual. Recent complaints like headache, depression, focal weakness, vertigo. Any recent injury, previous medical illness like diabetes, uremia, heart disease, access to drugs like sedatives, psychotropic drugs, etc. General physical examination include vital signs, evidence of trauma, evidence of acute or chronic systemic illness, evidence of drug injection such as needle marks or alcohol breath, knuckle rigidity, which needs to be examined with care. Blood pressure, if it is increased, the causes may be hypertensive encephalopathy, cerebral hemorrhage, or raised intracranial pressure. When the blood pressure is decreased, there may be hypovolemia, hemorrhage, myocardial infarction, intoxication, or poisoning. Profound hypothyroidism or Addisonian crisis may also lead to decreased blood pressure. Multiple injection marks indicates drug addiction, acute endocarditis, hepatitis B or C with encephalopathy, or HIV. Neurological examination is very important in the case of unconsciousness. First of all, the state of consciousness should be determined, whether it is obtundation, in which the patient responds to verbal stimuli, although slow and inappropriate, stupor, in which the subject can be aroused only by vigorous and repeated noxious stimuli, or coma, unarousable and unresponsive state. The Glasgow Coma Scale provides a practical method for assessment of impairment of conscious level in response to defined stimuli. The GCS measures the following functions and scoring is done on the basis of responses. These include eye opening, verbal response, and motor response. Generally, brain injury is classified as severe when the GCS is 8 or less, moderate when GCS is 9 to 12, and mild when GCS ranges between 13 to 15. Pupillary size and reactions are also important for the diagnosis of unconsciousness. Medium to dilated symmetrical pupils fixed to light indicate structural disease of the brainstem. Small symmetrical pupils reactive to light indicates metabolic diseases and drug overdose. Unequal pupil fixed to light shows intracranial mass lesions producing third nerve palsy. In vestibulo-ocular reflex, douching of one ear with cold water produces ipsilateral deviation of both eyes with a contralateral quick phase nystagmus lasting for 1 to 2 minutes. Use of hot water produces the opposite effect. That is, contralateral deviation with ipsilateral quick phase nystagmus. Bilateral douching with cold water gives rise to downward deviation with upward nystagmus, and with hot water, the opposite response. Absence or abnormal response indicates brain stem dysfunction. Oculocephalic reflexes, which are also known as doll's eye movement, should also be checked. Normal response consists of deviation of both eyes to the opposite direction of head rotation. Again, absence or abnormal response indicates brain stem dysfunction. Motor responses. These are checked by applying peripheral noxious stimuli, for example, pinching of limbs, rubbing the sternum to elicit pain, may be an appropriate response, in which the paralyzed limb will show no response, complete flaccidity with no response to noxious stimuli, often indicative of severe central nervous system depression due to drug overdose. Appropriate response by brushing away the source of stimulus may be seen. Respiratory pattern. Hyperventilation is an indicator of midbrain and upper pons lesion. Metabolic diseases, for example, hepatic coma, diabetes, and generalized raised intracranial pressure in its early stages. Hypoventilation indicates medullary and upper cervical spinal lesions, drug overdose, and later stages of cerebral herniation. Sheen-Stokes respiration occurs in diencephalic lesions and obstructive hydrocephalus. Ataxic respiration, which is irregular breathing, is a sign of brainstem dysfunction of a diffuse nature. Now, how to approach an unconscious patient. Initial management includes management of airway, breathing, circulation, any deformity, exposure to lethal gases, maintain IV line, oxygen inhalation, control seizures, and intravenous glucose administration. Once the patient is stabilized, the diagnostic evaluation should be performed. Radiography includes skull radiographs, computerized tomographic scan, carotid angiography, and EEG, which is electroencephalogram. Lab analysis include examination of CSF, serum glucose, calcium, sodium and potassium, blood gases and pH, liver and renal functions, along with drug levels. Definitive management. Management of the comatose patient depends on the cause. Whatever the cause, it should be managed accordingly. While the patient is undergoing evaluation, it is essential to perform pressure area care, care of the mouth, eyes and skin, physiotherapy to protect muscles and joints, risks of deep vein thrombosis, risk of stress ulceration of the stomach, nutrition and fluid balance, urinary catheterization, monitoring of the CVS, infection control, maintenance of adequate oxygenation with the assistance of artificial ventilation as and when required. This is a scenario for you to solve. You make a note and post in comments for discussion. Thank you for listening. If you like the video, make sure to drop a like. Let me know if you have any suggestions in the comments below.